Hello, students. This is Dr. Oviedo. I will be doing a lecture series on diabetes. Before I begin my first lecture, I should tell you that 1. It is best that you read the chapter on diabetes first before you listen to my lecture. 2. Please put away your cell phone to where you cannot easily reach it. 3. As you listen to the lecture, please write down your questions. I divided the diabetes chapter into 8 recorded lectures. The reason why I did that is it is easier for me to record in small bits, and it is easier for you to go back to your favorite or your least favorite episode, whichever the case may be. Lecture 1 is types of diabetes. Here I discuss the normal physiologic interaction between glucose and insulin, the pathophysiology of diabetes, and the 2 types of diabetes. Lecture 2 is all about the clinical manifestations of diabetes. Lecture 3 is about the diagnosis of diabetes. There are 4 diagnostic tools for diabetes. What are the threshold points for one to be diagnosed with diabetes or to be screened with pre-diabetes for each of these tools? And what are the nursing considerations for each diagnostic tool used? Lecture 4 is the goal of diabetes management. Strictly speaking, there is just one goal of diabetes management, and that is to tightly manage glucose levels. Which goes without saying that if we need to manage glucose levels within optimum ranges, we need to measure glucose levels. So in this lecture 4, I also discuss Accu-Checks. Accu-Check is a brand name, but is the most commonly referred term when healthcare professionals refer to measuring glucose levels through finger stick. Lectures 5 and 6 are about pharmacologic management of diabetes. Lecture 5 is all about insulin, which mostly refer to type 1 diabetes. Lecture 6 is all about oral antihyperglycemics, which exclusively refer to type 2 diabetes. Lectures 7 and 8 are about acute complications of diabetes. Lecture 7 is on hypoglycemia. Lecture 8 is about diabetic ketoacidosis or DKA and hyperglycemic hyper or smaller state or HHS. Chronic complications of diabetes is an independent study, so please study it on your own. Lecture 1, Types of Diabetes. This is lecture 1 of 8 lecture series on diabetes. By the end of this lecture, you should be able to answer these questions. 1. What is the normal physiologic interaction of glucose and insulin in the body? 2. What is diabetes mellitus? 3. What are the 2 major types of diabetes, and how can these 2 types be differentiated from each other? Think of a cell in your body as a factory. A cell manufactures fuel. The fuel that the cell produces is called ATP or adenosine triphosphate. ATP is needed for cell functioning. Just as you would need gasoline for your car to run or electricity to run the appliances in your house, in order for the cell to produce ATP, it needs glucose. Glucose is floating outside the cell. Here, glucose needs to be delivered into the cell, and insulin is the key that unlocks the entrance to the cell and makes it possible for glucose in the bloodstream to enter into the cell. Let me repeat. In the slide, you see the yellow insulin and the red glucose floating around the cell. You see a round flesh-colored cell with a blue and red and green circle on the cell membrane. The blue is an insulin receptor where the insulin will attach. After insulin binds with its receptor, it causes the green glucose channel to open and allow the glucose to enter into the cell. As glucose enters the cell, it causes glucose in the bloodstream to drop. That is the normal physiologic interaction between insulin and glucose. So, where does glucose come from? Glucose arrives in the bloodstream from one of three sources. One, carbohydrates eaten by mouth is converted to glucose via digestion and absorbed through the gastrointestinal tract. Two, glucose is released from stored glycogen in muscle and liver cells. Or three, glucose is created by your liver cells in a process called gluconeogenesis. Knowing where glucose comes from is important. This will help you understand oral antihyperglycemic drugs. So it is worth repeating. So where does glucose come from? One, from carbohydrates you eat. Two, glucose is released from glycogen in muscle cells. And three, gluconeogenesis. Excuse me. Where does insulin come from? Beta cells of the pancreas. So when you eat, glucose levels in your blood rises. In response to increased blood glucose levels, insulin is released from pancreatic beta cells. At the cellular level, insulin facilitates the transport of glucose across the cell membrane to the cell's interior. Inside the cell, glucose is metabolized as fuel, releasing the energy necessary for normal cellular functioning. So, normal physiology is the story of glucose in the bloodstream, insulin resting on the receptor to enable glucose to enter the cell, and cell using glucose to produce ATP, which is the energy for cell function. That is the story of normal physiologic functioning. And also, that is the story what goes wrong in diabetes mellitus. There are two types of diabetes, type 1 and type 2. There are other types of diabetes, such as gestational diabetes, and recent literature reports a type 3 diabetes, which is a diabetes in the brain that's linked to Alzheimer's. But in this chapter, we are dealing only with type 1 and type 2. Type 1 used to be called juvenile onset because it was typically diagnosed in children. Type 2 used to be called adult onset because the typical age at diagnosis was adulthood. However, categorization as juvenile onset and adult onset is imprecise because type 1 can be diagnosed in adults too. And with the burgeoning obesity in children, type 2 has become more common in children in recent years. Type 1 used to be called insulin dependent, and type 2 used to be called non insulin dependent diabetes mellitus. However, the categorization relative to insulin is also imprecise because there is also the possibility that patients with type 2 diabetes will eventually need insulin. So, what is the difference between type 1 and type 2? And why do we need to know the difference? We need to know the difference because treatment regimens for the two types are different. So, what is the difference? The image to your left represents type 1 diabetes. The image to your right represents type 2 diabetes. The left image, you can see glucose surrounding the cell as represented by the blue hexagons, but there is no insulin to be found. So type 1 diabetes is characterized by no insulin production by the beta cells of the pancreas. Type 1 diabetes is typically triggered by an autoimmune process in which insulin-producing beta cells of the pancreas are destroyed, resulting in an absolute lack of insulin. In children and young adults, this process is usually rapid, with total insulin deficiency occurring within 1 year, after which lifelong insulin therapy is required. The image to your right is type 2 diabetes. There is insulin as represented by the yellow ovals. Type 2 diabetes involves defects at the cell membrane that prevent the normal action of insulin. Even though insulin is present, the cell resists its effect in transporting glucose into the cell. Because of this, insulin resistance develops that requires increased levels of insulin in order to drive glucose into the cells. Over time, the pancreas cannot keep up with the increased demand for insulin, and beta cell failure appears and progresses. Toward the latter stages of type 2 diabetes, insulin production declines significantly so that approximately 30% of patients with type 2 diabetes eventually require insulin injections to maintain normal blood glucose levels. So what is diabetes mellitus? When there is a disruption in the production of insulin, or when there are defects in the effective action of insulin at the cell membrane, glucose cannot effectively cross cell membranes to enter the cell. Instead, glucose remains in the bloodstream and blood glucose levels arise above normal. The resulting hyperglycemia is the hallmark of diabetes mellitus. There are two types of diabetes. Type 1 is primarily characterized by insulin deficiency. Type 2 is primarily characterized by insulin resistance. Again, what is diabetes mellitus? It is characterized by chronic hyperglycemia. It is caused by problems with reduced insulin production or reduced insulin action or both. These typically lead to chronic complications such as diabetic retinopathy, hypertension, stroke or cardiac events, renal failure, or peripheral vascular disease and neuropathy, which lead to amputations. That's the end of lecture one. Thank you.